Good afternoon, friends. You have just seen the talk by Dr. Kamal Kapoor. So I'm just taking it a little forward, the same topic. So the topic is saving needle microcapsulotomy. So this is a technique to prevent Argentinian flag sign, intumescent, white, pearly, mature white cataracts, which we all come across in our clinical practice. And generally we land up with the anterior capsular tear extending to the periphery, radial tear, and finally into a Argentinian flag sign. So we have no financial interest in this subject. You know that what is Argentinian flag sign? Argentinian flag sign is a self-propagating radial extension of the anterior capsular tear, which is not in our control, and we do not desire that also. But it happens spontaneously without any control. So what happens, the moment you put a prick on the anterior capsule, so because of the high interlenticular pressure, the capsular tear starts extending peripherally, radially, and this is the final result. Now, the extension of the tear, as you have seen here, is parallel to the cut which we have put on the anterior capsule with the needle. And it's a peripheral and the radial extension of the capsular tear. Now this happens, why it happens basically, you could see here in this picture. So what we use normally, we use the 26 gauge hypodermic needle. We use sharp tip capsulorhexis forceps, and you see the tip of the needle is like a knife. When you puncture the anterior capsule, it makes a cut. So this cut is a linear cut. So you can see the cut is linear and it has a two edges, open edges. As Dr. Kamal Kapoor has just shown, like if you have a cut, if you leave the cut or if you leave the sharp edge of the rhexis, there is always chance of that rhexis extending to the periphery. But what we are doing in most of the cases, we use hypodermic needle and we intentionally make a cut on the anterior capsule, linear cut. But in a normal situation, that cut may not give you any problem. But if there is a high pressure within the capsular bag, high interlenticular pressure, especially in a hypermature intumescent cataract, then that cut is definitely going to extend to the periphery. This is a phenomena or physics. If you have a high pressure, the open edges will extend. And in 99% of the cases, this cut extends radial to that initial cut. It will never extend perpendicular to that cut. So it means the cut is important. So if the cut is important, then why we put the cut? So this is how we put the cut on the anterior capsule, and this linear cut, because of the high interlenticular pressure, tends to extend to the periphery. So you can see here in this animation video like this. It will never extend perpendicular to that initial cut. So it means this cut is very important because the linear cut which we leave on the anterior capsule is very, very important, and this should not be done. So this has been described by Daniel Perrone somewhere in 2000, and this is basically because it simulates to the Argentinian flag. So that is why it is called as Argentinian flag sign, with the blue color and the white nucleus shining through the blue color, through the radial extension of the tear which has taken place. Now why it happens? You look at this animation video again. So there are two compartments in a liquefied hypermature intumescent cataract, and that happens especially if there is a partial liquefaction. If you have a total liquefaction, then it will convert into a Morgagnian cataract. Morgagnian cataract means your nucleus is free. There is a liquid all around, the nucleus is free. But in intumescent white cataract, you still have the cortex which is left in the equator, but there is a liquefaction in the anterior to the nucleus and the posterior to the nucleus. So there are two compartments and then there is a high pressure. So what happens actually, the moment you puncture this anterior capsule with the needle or whatever you use, or the capsulorhexis forceps, this nucleus starts moving forward. So that is the forward movement of the nucleus, and then it hits back of the anterior capsule. So when it hits back of the anterior capsule, it adds to the high pressure within the interlenticular pressure. And now you have a, you know that you have a, you already made a cut on the anterior capsule, a linear cut. And because of this hit by the nucleus and the high pressure, this cut starts extending to the equator. So that is why you get into the problem of Argentinian flag sign. And you know the complications of the if you have Argentinian flag sign, it can wrap up around the equator and go into the posterior capsule. And if you get this tear goes into the posterior capsule, then you may have a lot of complications, the nucleus drop and so many problems which you have to deal. So what we have done, we devised a new device instrument which is called as a saving needle capsulotome. And the technique is called as a saving needle capsulotomy, microcapsulotomy. So what we have done, you see this picture on the left side, these are the needles. So these needles are the saving needle, जो saving needle machine में use होती है, saving needle. And this saving needle has a tip which is round and circular. It's not like a hypodermic needle we use for injections. It's a round and circular. See, the tip is round and circular and pointed tip. So we made a device with it with this similar tip. So this is called, this is the tip. So now this tip is round and circular. It's not like hypodermic needle. And this is somewhat, it will look, this is animation, somewhat it will look like this, a round and circular tip. Now what happens when you, as I have already shown, when you puncture anterior capsule with the hypodermic needle, that you can see here, if you, now these are the two different kind of needles you can use. So hypodermic needle, when you puncture, as I said earlier, it makes a cut, it makes a linear cut with two open edges. But if you puncture this capsule with this needle, the second one, what it does, it makes a hole. See, so there is a lot of difference in the two. Now if you have a hole in the anterior capsule, now this hole will never tear. So that is the natural phenomenon, because this has a continuous edge. So there is no discontinuation in this hole. It's a continuous edge and it's a hole. So whatever amount of the pressure is there in the capsular bag, this hole will not tear. The fluid will start coming out of this hole and the intracapsular pressure will come down. The pressure will decompress, and then once the pressure is decompressed, you can start the axis. The pressure decompression, actually, you don't need to decompress the complete intralenticular pressure. It's just even a single drop of the fluid comes out is enough to decompress the capsular bag. You don't need to decompress everything. Just one drop is enough. So this microcapsulotomy, because this works like a mini capsular access, which we have been advocated doing earlier, mini capsule. But making mini capsular access is not easy job, because again you use the sharp tip and then you try to make. But problem with the Argentinian flag sign is, if you have a high interlenticular pressure, the moment you prick, you don't have a control and it starts extending to the periphery. So to prevent that problem, this device is going to work very well to make the hole. And you can see here in this video, so how it is being done. So what you have to do is basically, this is an intumescent cataract, completely mature intumescent cataract, white cataract. You have to stain the anterior capsule, and staining should be done under air bubble, and stain the capsule very well. And once you stain, inject viscoelastic. You don't have to use rap tape. You can, viscodispersive is enough. Don't pressurize too much. A very little amount of the visco device should be injected in the anterior chamber. And then this is the microcapsulotome. Take it inside, put it vertically. What happened? It's not working. Okay, no problem. I'll show you this video again. Okay? Ready? हाँ आगे कर दो चलो ठीक क्या है तुम्हारा हमारा ऑडियो विजुअल क्यों नहीं काम कर रहा भाई? बस वही वीडियो मैं दिखा रहा था, आई डोंट नो। हाँ, हाँ, नहीं चल रहा। हाँ, तुम्हारे कैरेक्टर्स सही नहीं है क्या? स्टार्टिंग से हो रही है तो खुला हुआ है। अच्छा एक सेकंड,
Vishwas,
एक सेकंड,
Chairman Scientific Committee
रुक जाओ।
for the next 3 years in
Okay.
this conference.
So it has come now, and I'll just wanted to
forward
show
kar
you this video. I'll take forward. So you have already. Uh, so this is the microcapsulotome which is going inside, and you puncture the entire capsule. So you could see here, the moment you puncture, the fluid starts coming out. So this amount of the fluid which is coming out, and then you can like milk it out, like the milking technique, like you press from the periphery and you can milk out the fluid out of the capsular bag. And once the fluid is milked out, and then you can start the capsular access. So you can see very simply you can complete the capsular access without any hassle, and you can get any size of the capsular access and complete the surgery. So sometimes what is important is, like, if you don't even stain the anterior capsule, you can continue with this technique. I'll show you the last video. This video is a little important because what happens, you may not get the hole formation every time. So after all, the capsule is fragile, because when you puncture, you may get a ragged hole formation. But here you can see in this particular case, you got a flap formation. Instead of hole, there is a flap. But even if you get a flap formation, flap also will not extend, because there is the pressure distribution on one side, because it's not, and the moment you puncture, so some amount of the fluid already has come out. And then you can basically carry out the Raxis formation as the size what you wish, and then complete the phaco surgery. So this is the capsulotome. This is how it looks like. It's been designed by us, and Epsilon is making it, and will be available with Epsilon in a short time. This is the last video. So what actually, if you actually finish? Okay. All right, then. So this technique actually is going to work in intumescent mature white cataract, and this device is definitely, it's a very simple. That is the main important point, is the device. Otherwise you have to use femtosecond, Zepto, or you'll end up with the Argentinian flag sign. But you have seen this is just a simple device of 1 rupee, 2 rupee device, and it gives you a equal functioning like the femtosecond does in the intumescent white cataract.